On February 1st, I had some pain at home, a lot of chest pain. Started off very mild, but it became very intense as a little bit of time went on. We headed for Rutland to come over here to the ED.
Sometimes when patients come into the ER, there's a certain group of patients who will come in that we pretty much bypass the triage area because of the way they present or what's going on with them. And his complaint was of chest discomfort with a history of cardiac issues, and he had a bit of a pallor. So I remember we walked him straight back to room 7.
One thing that really stuck out with me is, as I was initially talking to him and evaluating him, he looked up at me and asked if he was going to die. And through my experience, that's never a good thing when a patient who has something very major going on with them says, I think I might die. They oftentimes seem to have a premonition about that, and I tend to take that very seriously. So both myself and the lead nurse in the room, Chris Andrews, recognized that, and I asked him to place pads on his chest in case something did happen. I subsequently left the room to talk to my charge nurse and start to work on getting transportation up to the University of Vermont Medical Center for Mr. Donovan. And I was quickly called back into the room because he had gone into a heart rhythm called ventricular fibrillation, which is a deadly rhythm. He had lost consciousness and had no pulse. I asked my nurses immediately to deliver a shock to Mr. Donovan, and after one shock, he woke up and actually asked me, did I pass out or did I die?
When I came back to, I said to the doctor, I says, I missed some time, didn't I? He goes, yes, a couple minutes. You're okay. We got you. I think that everybody on that team did a fantastic job. I mean, even down to the people that kind of took my daughter by the hand and said, here, we're working this through. We're getting this. This is what's going on. And I know when my wife came in, you guys were very good as far as telling them, get on the road to Burlington. He'll be in the air in a few minutes, but get there and drive safe and don't drive fast. And he'll be in the operating room by the time you get up there. So there were a lot of things to pull together that night. It is important to say thank you